After understanding that knee arthritis is not just wear and tear, the next advice most patients hear is this: just exercise, build your muscles. Exercise is important, but the real question is exercise enough to treat arthritis? Let me be very clear at the start. Exercise is beneficial. Exercise is beneficial. It improves muscle support, reduces joint loading, and improves function. No responsible orthopedic doctor will say exercise is useless. But knee arthritis is not just a muscle problem. It is a biologically active joint with ongoing low grade inflammation. And exercise alone does not switch that inflammation off. If you want to understand knee arthritis properly, not myths, not shortcuts, but evidence based options, subscribe to this channel. This channel is structured like a clinical consultation, not social media advice. Many patients tell me, Doctor, I did physiotherapy for months, but the pain returned. That does not mean exercise failed. It means exercise addressed mechanics but not the joint environment. Inside the knee, inflammatory signals continue to irritate cartilage, synovium, and bone. So, when pain comes back, it is not because the patient did something wrong. It is because the biology of arthritis was never addressed. This is why treating knee arthritis requires more than strengthening exercises. Exercise is a foundation, but foundations alone do not treat disease. To understand what actually keeps arthritis active, we need to talk about inflammation. In the next video, I will explain how inflammation works inside the arthritic knee and why it fails to resolve on its own. That understanding changes how treatment is approached. Exercise supports the knee. Biology decides whether pain persists. Don't fail to watch the next video on inflammation.